financial year, and some of those officials that contracts had expired were reinstated or reappointed. But because of the delay or because of the late the period that they were not in the department, we realized SEV. And we also tried to ensure that we implement cost containment measures that were introduced by National Treasury as well as Provincial Treasury, Chairperson. On economic classification, compensation of employees, we've spent 96.75% of our budget. Goods and services, 92.05. Transfers and subsidies, 57.51. Payment of capital assets, we spent 70% of our allocation. And Chairperson, we also had bad debts that we had written off, amounting to 269,000. In terms of programs, Program 1 is its administration. It has spent 98.46% of its total budget, which resulted in a variance of 1.5%. Chairperson, we recognize this variance as within the norm. This is the breakdown in terms of economic classification under Program 1. Compensation of employees spent 99%, goods and services 98%, transfers and subsidies. This talks to the leave gratuities that were paid to officials, to ex-employees. We spent 96% of the budget, and under payment for capital assets, we spent 81%. Under Program 2, Institutional Development, the program has spent 80% of its budget, and that resulted in a variance of 19%. Chairperson, this is where the earmarked allocation for provincial bursaries is sitting. And as I have already alluded to the problems that we faced in relation to cash, that's why we're having this high underspending, Chairperson. Under Program 2, in terms of economic classification, compensation of employees, we spend 98%, goods and services 91%, transfers and subsidies 55%. That's where the bursaries are allocated. Payment for capital assets, we spent 59%, and there were write-offs that were done, amounting to 94,000. Program 3, Policy and Governance. The program spent 95% of its total budget, and the variance is 4%, and this variance is within the norm. In terms of economic classification under Program 3, compensation of employees, we spent 99%, goods and services 91%, transfers and subsidies 100%, and there were also write-off of bad debts amounting to 159,000. Program 4, Monitoring and Evaluation. The program spent 92% of its allocation, and which resulted in a variance of 7%. This variance is mainly due to compensation of expiry of contracts under compensation of employees. And the expiry was done in line with the Public Service Regulation 57, Chairperson. Thank you. In terms of economic classification under Program 4, compensation of employees, it's at 94%, goods and services 70%, transfers and subsidies 96%, payment of capital assets 83%, and write-off of 16,000. Thank you, Chairperson.
Yeah, thank you, CFO. This thing of using a small gadget, a phone, it creates a problem for me. Thank you, CFO. Honorable members, there's a presentation from the Premier's office. Any questions? Dr. Werner?
Thank you very much, Chair, and thank you for the presentation, CFO. Yes, Chair, I just note that in terms of the under expenditure, that the Office of the Premier at 10.4%, that's basically 62 million, is the department that has the highest under expenditure of all departments within the Free State Provincial Government. So yeah, just to note that. And I just would like to better understand this issue regarding the cash flow problem versus the budget. Is it a historic issue? Because I do note that it is the explanation being given for the under expenditure is cash flow. But if the committee could just better understand in terms of the historic issue regarding that problem with the cash flow that led to the 62 million being underspent. Thank you, Chair.
Thank you, Deputy Speaker.
Thanks, Chair, and good morning to the Portfolio Committee members, and good morning to the Premier and the officials from OTP. Chair, perhaps I would just like to find out from the Premier's office, because we expected them to appear before the committee last week, and they did not attend, and there was no explanation in that regard. Though we do appreciate that we resolved and took a decision, but perhaps if they are able to then also respond. Chair, I'm covered by the underspending. It's also an issue that I also wanted to understand, but that has been covered. The department will also come to respond on that. And then on the issue of the dysfunctional municipalities, I just wanted to find out, having come back from the National Portfolio Joint Committee that we had, I think it was 2 weeks ago, if I'm correct. Now, I would like to know, in light of that, what is the department, the OTP, what measures are in place to ensure that there's accountability where in municipalities that have been cited as failing municipalities in terms of coordination or service delivery? And also, I just would like to find out the support that the Premier's office gives to these municipalities. Are there specific support programs that are in place? And that my last question now, Chair, is there a way where OTP is able to establish a provincial, let's say, I don't know, something where they're able to detect early warning signs of these failing municipalities, so that they are able to act in time in trying to assist them? Thanks, Chair.
Deputy Speaker, I've just posted the letter from the Premier's office, which we received some days ago, last week, I don't remember. I just posted it in our group. In the meantime, you can go through it. Director?
No, thank you, Chairperson. Good morning, Honourable Speaker and the department. Just to add on, Honourable Ndungane, I think we were all quite depressed after those 2 days of meetings with the National Portfolio Committee. But yes, as they say, it is what it is. My question, I think I'm covered by the issue of the cash flow by Honourable Pretorius. I've got one question to the department. Can they maybe indicate to us what is the monthly salary of a CDW worker, a community development worker? That's basically my one question. A monthly salary after deductions of CDW workers. Thank you, Chair.
Thank you. I don't see any other hand. Maybe what we also have to also reflect on is that in interacting with different departments, what has been standing out is that presentations of department never make a reflection of cooperative governance. No, that must be there between department, especially in relation to specific projects or specific programs that departments must be undertaking. And I think out of that we then had also said that we really have to have a day with the Premier at some point where we discuss with the Premier on these issues. The second issue is that the worrying factor of the underspending of the department. This is the department that must be giving an example, setting an example for others. What causes this underspending in the department? Thank you. Over to you, Acting DG.
Chairperson, thank you very much. Let me start by responding to few statements, and I think the administrators will be able to touch on administrative issues as we are called to this portfolio committee to consider the fourth quarter expenditure report for the 2024-2025. We did not anticipate questions like the questions that are local government portfolio committee, and none of these officials will be able to respond to such questions, Chairperson. And as we all know that when we are called in front of the portfolio committee, we are expected to report on this expenditure now, and there's other matters of 2 weeks and so on. I think those are just matters that need another level of engagement, where I agree with you that if we engage at that level, we'll be able to put a constitution in front of us and say, these are the responsibilities, these are the applications that are expected from, from the Premier. Because at this level where we are, these were joint committee, portfolio committees that met last week, and all of us were in front of those portfolio composed the legislature and the national. Both of us were members who were now interrogating the local government. I don't think I was there as a representative of local government, but as the head of the provincial government, of course. And it's unfortunate that this question comes at this time, Chairperson, where one cannot really be detailed, but perhaps just to share a little bit of information that the issue of failing municipalities, Chairperson, the past 2 days we had a session with, it's just for sharing because it's not part of what the portfolio committee can judge us on. We had a session, myself, MEC, Treasury, MEC, COPTA. On Monday, we convened meetings with municipalities just to check how far are they after the visit? What is that they did after questions and clarities that were sought by portfolio committee? Tuesday, which was yesterday, the very same meeting continued with Lijoli Putswa and Fezile, because we started with Parip and Thabo Mofutsa-Nyana and Mangaung on Monday. On Tuesday, it was then Thabo Mofutsa, Lijoli Putswa municipalities and Fezile Dabi municipalities. But unfortunately, Chairperson, we had to host the Deputy President yesterday, but Ntate Saki Mukwena continued with those meetings, and we've all given them a week to come back. It's not that we are not doing anything, Honorable Dungwana. We are working closely with those municipalities. And as we know that some of the powers that people might think we do have, we don't. But the parties that send these people to those municipalities are within those political parties. But administratively, we are working hard in dealing with all these matters, and we'll be able to make some recommendations. We started for the past 2 days, Honourable Member. That's part of the support, and I remember us also about the support. The Office of Monitoring and Evaluation in the Premier's office, Chairperson, has been strengthened. And remember, we had a DDG who's been on suspension for a very long time, and that DDG only received an award yesterday in Tetepera. Like in that Chairperson, we are not like when we are seated in one boardroom. It's like we are at the legislature. Yes, we received the award yesterday, dismissal. But before that, we have to have one HOD to be part of strengthening the monitoring and evaluation. And the responsibility that was assigned to them was that now the focus is going to be on these municipalities. Richard, what is that we can do to support and assist these municipalities? And that's where we are. And I'm happy, Chairperson, that you raised the issue of apology. Honourable Member Dukwane, it's not that we undermine the committee, and I've never undermined the committee and the team here. There was in no way that a Premier cannot be there, even officials themselves. There was miscommunication, and Mentungwan were available. Even if I was not going to be available, I would have allowed the team to come and present. But when we learned about the committee, it was after the committee said that we were expected to be there. The PLO lies with the team, and where the email was sent, we don't know why this time around our PLO was not consulted, and even the office of acting DG. So we did apologize officially, Kalengol. I'll hand over to the CFO. Thank you very much.
Thank you, Honourable Premier. Honourable Chairperson, the issue of cash versus budget or budget versus cash, is the reason why we have underspent in the budget of the Office of the Premier. This is as a result of the over expenditure or unauthorized expenditure that was incurred by the department during financial years 2017-18, as well as 2018-19. In those two financial years, a total of 209 million was overspent. And in terms of the requirements of modified PET standard, when there is such over expenditure, there are funds that we need to pay over to the provincial treasury. Or as a result of that, in the subsequent financial years, when you have any underspending of the budget, we have to surrender funds. So what happened in those prior financial years? At the end of every financial year, when we have underspent, we're expected to surrender. So they surrendered the cash that was supposed to be the cash that will be used in the current financial year. So we started each financial year with a cash deficit. So this continued until now. So what we have done in the previous financial year, we had requested Provincial Treasury to assist the department with an application that seek to invoke Section 79 of the PFMA. That section, it allows or it provides for the department or the accounting officer to depart from the requirements of treasury regulation and the conditions that are in the PFMA as well. So we're still awaiting response from Treasury, because our request was simple to say, because we always underspend our budget due to cash flow challenges, can we at least National Treasury approve a deviation for the Department of Premier to surrender unspent funds every year to Provincial Treasury, so that we can be able to spend our budget in accordance with the mandate of the department. Thank you, Chairperson. CDW salaries, every month we spend around 10 million. So in a year, it will be, the projections are around 120 million, Chairperson. Thank you.
Also, it doesn't, I don't know whether Ndari Kluter was saying per person, wanted to know whether how much is a CDW getting per month. If I misunderstood you, honorable member, you'll bear with me.
Honorable Khabani, you're correct. I asked what's a monthly salary after deductions of a CDW worker. Not the total budget, but monthly salary. Thank you.
Over to you, DG.
Chairperson, CDWs, they are coordinators, the district coordinator at level, the coordinator, a district level of assistant director. Then lady CDWs at level 6. But for honorable member to ask about after deductions, it's going to be very difficult for acting DG to know after deductions of what, because as you know that when you got your own package, if one doesn't have a medical aid or UIF, so we won't know what is that you are left with after deduction. But the correct response, it is to respond about levels. That is there, and it's regulated by DPSA. It's level 6 and level 9 that we have. You can just make calculations. If I have to assist the committee, level 6, you are earning between 100. Is it 100?
No, I think it captures. Once you give it, yes, I think once you give it in terms of levels, then it's easy to relate to the salary. Thanks, Premier. Honorable members, I don't know whether you still have follow-up questions. Ndari Kluter?
Chair Thabo Meko.
Ndari Meko.
No, Chair, on the two issues, I've read the letter of the Premier to the committee. As you made the reference to that letter when Honorable Tungwana was asking about the presence of the Premier. The meetings of the Portfolio Committee are convened by law, Chair, and they are cost incurred. And we cannot afford as a legislature that when these meetings are convened, there is a no-show by department, especially when the no-show is caused by the very personnel of the legislature. So I think we need to resolve that. The matter needs to be investigated and a report needs to be given. So that in the future, the impression that Premier did not appear for whatever reason is not going to be sustained. That something has got to be done. The Portfolio Committee needs to write to the presiding officers or chair of chairs so that there's clarity and that report needs to come. Number two, we are dealing with an issue about the salary of the EPWP from one municipality. One issue which came out to demonize our province as a province that is leaderless and quite critical in terms of oversight. And look, it is my understanding that oversight is not only by the legislature. Premier also does oversight over provincial government. There's oversight also in municipalities, I suppose, is by MPEX. And all of that work was put on the spotlight. So I would appreciate that the response must be clear. The response must not be, Chair, that let's go and investigate the levels. Let's rather ask the Premier to provide the committee with a report, because we want to go deeper to understanding these issues of the EPWP. But whatever portfolio committee of the legislature, but finally there's got to be this clarity existing. This information must be available to the oversight of the legislature. How much is a coordinator earning? How much is an ordinary EPWP earning? The Premier was also explaining that there are assistant directors, all of these people. And this will also help us to clarify this thing to the people of the Free State. Now the legislature doing its responsibility, and supposedly the provincial government, the Premier has indicated that the whole week they've been meeting municipalities to engage, to correct, to demystify some of the distortions about our province. So I will request, Chair, that let's ask the Premier's office to give us that report. I don't know it's in relation to the entire province, or is it only EPWPs that are in the office of the Premier? But whichever way, let's ask that the report needs to come to the portfolio committee. Thank you.
Dademeko, I think you are confusing issues. The question was about the CDW, not EPWP. That's why I was saying, when the Premier was giving reference to the levels, that it's easier that because salaries of public servants are clustered in terms of levels, and that goes to the issue of experience and all other, but within the level. So within one level, people may get different salaries determined by other issues that the human resource in the department would have determined. But maybe we can say that this report must, in terms of the payment of CVDWs, must be supplied. The report must then be given in writing to the committee. But it was about the CDWs, not the APWP. Thanks. Are there no other questions? If there are no other questions, I will then.
Chair.
Oh, Dadefoko.
Good morning, Chair, and let me welcome the presentation by the Premier and the team, Chair. Chair, the next meeting, please, you must check your gadget, because since my hand was up and you didn't recognize me. But
yes,
I'm covered, Chair.
I'm sorry.
Yeah, okay. I'm covered by your explanation now, the difference between the CDW and the other, Chair. Thank you very much.
Thanks. Honorable members, let me give over to the Premier for the closing remarks so that we can release them.
Thank you very much, Chairperson, and thanks for the explanation, because really I was noting when Honorable Member was presenting that EPWP, it's with Public Works, CDP, it's with COGTA, ours is CDWs, and these are permanent CDWs. That's why we are relating it to the levels within the DPSA regulations, that key level so and so. And thanks very much. You also reminded me that you were once a public servant. That's why you were able to relate to even the skills and so on, and the levels within the same position, but different levels. But also, Chairperson, thanks very much. And I also share this information, Honourable Member Mekwa. Indeed, we are meeting municipalities, but once more, your concern around the issue here, EPWP, I think it's related to Machabeng municipality. Unfortunately, Honourable Member Mekwa, yesterday, Machabeng was supposed to appear, but the mayor requested not to be present, tendered an apology on the eve, in the evening, when they're supposed to appear on yesterday. And what was also unfortunate was that we requested even the mayoral committees, CFOs, senior managements to be there. But the report that I got from MEC yesterday was that only one member of MECO was there. No senior management, senior managers were able to attend that meeting. So we are making follow-ups. I'm meeting the MEC later today, Retleka Plan B, how to address those issues. Because indeed, we took it upon ourselves to engage with these municipalities, not waiting for legislature, not waiting for portfolio committee, but to start engaging with these municipalities. But to our surprise yesterday, there was almost no show for Machabeng chairperson. But thanks very much for the questions and the contributions made in this portfolio committee, Honorable Chairperson. Ke a leboha.
Hello. Hello.
Hello.
If we can hear you, the premier is done.
Yeah, yeah.
Okay. No. The phone. You know, when the call, when the phone is ringing and you have to drop it, it takes time to recover. I don't know. Majeki, how do we let in the Department of Health?
Chair, good morning again. I've just called them to join in, Chair. Thank you.
Okay. Thank you.
Chair, can we scan her whilst the premier and the team are going out?
Okay.
Just a way forward.
Yes.
By the committee.
Maybe
That's
let's start with Majeki. Can you lower the hand of Ndate Venel? I know he's got they laugh at me because of my gadget, but they forget Ndate Venel because he has a problem with it. Once he can raise his hand, it never goes down because he doesn't know how to use the gadget. Okay, let's.
Jay, thank you very much. And the worst part is I'm not even using a phone. I'm using this MacBook, state of the art, but it says here lower hand. And if I press it, it doesn't want to. So at some stage, I will have to see Ntati Steve at ITC to assist me. But really, I'm trying my best. This thing does not want to give its cooperation. I apologize for it, but I must attend to it at some stage.
I understand. I already know. I understand.
No, maybe Honourable Pretorius bought his MacBook from Machabeng because it's. I'm concerned about what I just heard when the Premier spoke about Machabeng and those issues raised, and it's in the media as well, are very serious. And it's time that we start showing our teeth as well. It feels like the legislature, we know what's the right thing to do, but we can't get to the point where we start doing that. So really, we need to start working urgently because now the Premier is doing her oversight role, but we have a role to play as well. And we need to start zooming into these issues because if we don't, next year when the National Assembly is here again with their committees, we're going to sit with exactly the same situation that we saw 2 weeks ago. Thank you, Speaker. Or Chairperson.
No, you remember that we in the last meeting we had said that we need a day where we discuss with the Premier's office and COGTA before we call municipalities. So maybe it's good that they are having those sessions now, so that when we put a day with them, it will be part of the report that they'll be giving to us in relation to the sessions that we're having. So I think that resolution still stands from our committee, that we are going to go to municipalities, but we must first start with the department, with government, provincial government, to get to understand. Remember, we even make reference to say that these Section 71 reports that must be submitted every month. What is Treasury doing about them? You know, the work of Treasury in terms of playing oversight role in municipalities and many other issues. I hope that our that resolution still stands, that in no time we'll then set the date to see provincial government and then shoot straight to municipalities. Ndatemeko? Ndadefandemiko?
That Klute, I think, has covered me, including your summary. That things must not appear in front of us and we don't see their finality.
Yes.
So I'm simply agreeing with you and that Klute, that we also have got to make a follow-up in terms of the issues arising from the portfolio committee visit. How do we do it? It's another issue, Chair. I have no issue. Thank you.
Thank you. Are we having them in the meeting, Mayor Cheki?
Chair, from my side, I can see Mayor Wametpas Mebu Tumelo. Yeah.
Okay. Okay. Let me phone them. Just give me a minute to two. Let me just phone them.
We are locked in. We are locked in, both of us, and the MEC. Thank you, Chair. The team from Health and the MEC have joined the meeting, Chair. Thank you.
Chair.
Mejeki, the HOD and the MEC are already in the meeting.
Chair.
I can. Mejeki?
Apologies, Chair. This is Honorable Ndungane.
Oh, Deputy Speaker.
Yes, Chair, I would like to be excused from the meeting. I have another meeting now at 10. If I finish early and you're still on, I'll come back to the meeting.
Oh, no problem, Deputy Speaker.
Thank you so much. Bye.
Thanks. MEC and HOD, you'll indicate when you are ready.
Good morning, Chair, and good morning, members. The team from Finance is ready to be taken through the process, led by myself, and the HOD and the CFO on the team.
Thank you.
Greetings, Chair.
Let me see.
Yes, greetings, Chair. Greetings to the honorable members and the staff. Yes, the HOD is correct. The team is here. I was just struggling with the connection this side, but the team is here, and we will be led by the HOD in terms of who will present what. And yes, thank you very much for the opportunity. We always value coming to the committee and always value the inputs, advices, and the the wiseness that we receive from the committee. Thank you very much. We are ready to present, Chair.
Thank you, MEC. HOD, you'll indicate who's going to make presentations so that they can take the oath or affirmation. You are not audible. You are still mute. Okay, you're unmuted now.
Thank you, Chair. I will start.
HOD.
I will start, Chair. There
Okay.
are 3 other colleagues that are going to take an oath.
Are you taking an oath or affirmation?
An oath, Chair.
An oath. Please state your name, full names.
Ernest Mshaso.
Do you swear that you will tell the truth to the committee and nothing else but the truth? If so, raise your right hand and say, "So help me God."
So help me God.
Who's the other person?
Chair, it will be the CFO, the financial director, head of clinical, and representative from the medical team. CFO.
Good morning, sir. An affirmation or an oath?
An oath, Chair.
Please state your full names.
Moses Moremi.
Do you swear that you will tell the truth to the committee and nothing else but the truth? If so, raise your right hand and say, "So help me God."
So help me God.
Who's the other person?
Good morning, Chairperson, committee members.
An oath or an affirmation?
An oath, sir.
Please state your full names.
Christodolos Sava Eleftherio.
Do you swear that you'll tell the truth to the committee and nothing else but the truth? If so, please raise your right hand and so help me God.
So help me God.
The next one.
Good morning, Chair.
Good morning, ma'am. Please state your full names.
My name is Grace Mutipani Lamdan.
Do you swear that you'll tell the truth to the committee and nothing else but the truth? If so, raise your right hand and say, "So help me God."
So help me God.
Who's the other person?
Good morning, Chairperson.
Morning, sir. Please state your full names.
Alfred Nakane.
Do you swear that you'll tell the truth to the committee and nothing else but the truth? If so, raise your right hand and say, "So help me God."
So help me God.
That will be all, Chair.
That will be all, yes. Over to you, HOD.
No, thank you, Chair. And honorable MEC, honorable members. We are going to take the members through the presentation for the 4th quarter. The CFO will deal with the presentation. And I'm not sure, MEC, if MEC wanted to come in first, but we are ready with the presentation.
HOD, yes. I'm the chairperson.
Okay.
I give over to you. I gave the MEC for opening remarks.
Okay.
He did. Yes. Over to you.
No, thank you, Chair. My apologies.
Unless if you say MEC must make the presentation. Thank you. Over to you, HOD.
CFO, you can take the members through the presentation in summary. Thank you.
No, thank you very much, Chair. And once again, morning to the honorable members. I'll be presenting the fourth quarter financial performance, Chair, for the financial year 2024-2025. That is the table of contents in terms of what I'll be presenting, Chair: budget and expenditure performance, the program, economic classification, conditional grants performance, earmark fund, accruals and payables, and then the last part will be the revenue collected. For the financial year 2024-2025, our total budget, which is the third column, final budget was 13,796,765. That is the total budget that was allocated to the department for the financial year 2024-25. That's at the end of March 2025, Chair. We have actually spent 13,514,845 of the 13,796, Chair, which translates into 98%, Chair, of the total expenditure. The 281, Chair, what you see there on the column second from the right, is the money that was unspent, Chair, just at the end of the financial year. I'll actually present the narrative in terms of those particular expenditures in the next slide, Chair. So this is the money that we've already surrendered to Provincial Treasury, Chair. And,
it's dark on my side, CFO. CFO, on my side is dark. I don't know whether it's only me.
I can see.
Honorable members, are you able to see the presentation?
Yes, Chair, we are.
Oh, so it's my gadget again. Oh, thank you. No, go on, CFO. Continue, CFO.
Chair.
No, thank you very much, Chair. These are the narratives as I had presented the programs. The program one actually underspent by 15 million. The unavailability of cash had actually played a major role in the department's overall under expenditure on most of the program. Chair, the department has historical unauthorized expenditure that has resulted in a portion of the cash received in the current budget being utilized to keep his bank account in a positive balance and is not available to utilize for operation. The challenge will persist until the historical unauthorized expenditure is resolved and returned to the revenue fund. I must indicate here that in the meeting that we had with both Provincial Treasury and National Treasury yesterday, we've actually presented this particular challenge to them and also seek their assistance. So that we have situations where when you start the financial year, your budget is equal to cash share. Program 2, goods and services, this one was actually underspending by 114 million, mainly because of laboratory services. Those are the cost drivers: laboratory services, fleet services, medicine, and operating lease. And compensation of employees also underspent by 119 million and capital expenditure by 777 million. Chair. Program 3, the overall budget underspent. However, operating these fleet services, that program is the EMS. The fleet services there continue to be under pressure almost year on year. Program 4, the underspending is on goods and services, and that is linked to the general hospitals, 126 million. And the underspending there is on medical supplies, and the availability of cash is a serious issue. Because of the almost year-on-year throughout, we have situations where just towards the end of the last quarter, which is the fourth quarter of every financial year, we have situations where the cash is actually not sufficient to cover all our expenses, and as a result, then we'll have some of the programs that are underspending. Not because we don't want to spend the budget share, but because you need actually budget to also fund those particular expenditures. But as I'm saying, we are working towards the situations where we can have a situation where beginning of the financial year, cash is equals to budget, so that then you are able to spend almost 100% cash. But if you're still having those particular pressures, that will be the situation. Sure. The program 5, that one also underspent by 43, and it's because of the capital assets there. Laboratory services, program 6, also under expenditure because of unavailable cash. Program 7 also under spending because of available cash share. And then the program 8 is this one. I think we did so well, almost spent 98%. The only portion there was just for the COE. Okay. Chair, these are the narratives on the environments. I'm not gonna go too much because what we normally do end of the financial year, we'll have to look into all the performance of the programs, and some programs or some expenditure line items that are not spending and other that are overspending. We need to actually reconcile and balance the two, so that we don't have a lot of excess. So these are all the environments that we've done. And there's a total value of the renewable request of 159 million, which is what we've actually applied. So which means that of the 281 that we've surrendered to Provincial Treasury, we have requested that the 159 million be given back to us. Because it's not mainly because of we did not spend the cash, but it's because we did not spend the budget, but it's because of the cash. So we still had accruals for that particular financial year, 24-25. which we still have to pay in this current financial year. And these are some of the accruals that we have actually requested the Provincial Treasury to redirect that money back to us so that we don't lose the whole 281 million. Treasury Chair. And this is the expenditure according to the economic classification chart. Still, same budget, 13,796,000. You'll see there, Chair, that on the goods and services, we had a budget of 3.353 billion, 3.6 billion, and that's at the end of the financial year. If you look into the column 1, 2, 3, 4, 5, on the right, 3.6 billion. That's at the end of the financial year. We had actually spent 3.9 billion, which means we actually spent 329 million more, Chair. But if you go down there, Chair, you'll realize that under building and other fixed structures, we had an under expenditure of 381 million, Chair. What has happened, Chair, is that we had to correct the classification because we've been getting audit findings from the Auditor General where some of the expenditures that are of current in nature are still being paid under the capital. So what we had to do here is we are correcting the classifications where we were spending money on the goods and services. So this two together, 381, and that was more is actually being offset by the other one that is on goods and services, Chair, so that we address this finding that we've had in the previous financial year from the Auditor General in terms of misclassification of both CapEx and current expenditure, Chair. These are the narratives in terms of what I've just explained, Chair. I'm really not going to go through it one by one. Chair, it is there. Not going to read it here, but I think it's safe to say that if you look into goods and services under current payment, you say the department has corrected the classification challenges in goods and services and capital expenditure on infrastructure project. This correction has led to misalignment between budget and expenditure and reflects lower expenditure. That's exactly what I've just explained, Chair. That you see situations where we had we had under expenditure on the buildings and other fixtures, but we have over expenditure on goods and services. This is exactly what I was included in for the transfers, included in the departmental agencies. It's 40 million that we almost annually pay to medical debt, so that we can also address their pressure there. And we're also sharing HWC, but also 23 million every year. This is the conditional grant share, 100%, almost 99.9% that we've actually spent on the conditional grant. We try by all means, Chair, not to underspend on the conditional grant because we don't want money that is actually taken back to the national fiscals. So you'll see there that almost all the conditional grants, your district health programs, provide NTSGs, HWP, and the statutory union resources in the training, almost paying 100%. The only grant that did not spend 100%, Chair. It's that one of the national health insurance. We underspend by 3.9 million from the 29 million budget that's allocated, which then translates into 86%. Chair. I'll explain the narrative in terms of that particular underperformance on the NHI. NHI is the grant that we are using to pay these doctors that are providing sessions in facilities. We pay them the patient that they are seeing in share. We are not in the first quarter, but I think this one we've been aware, we've adjusted the stipend for those doctors. We had a bit of a challenge here, but it's not going to be the same challenge in this financial year, Chair. That is the National Health Insurance Chair there, that spending is below the benchmark due to the delay in the recruitment of specialists, psychologists and psychiatrists. They are also being paid under this particular grant. The rest of the other grants have actually spent 100%, Chair. Chair, earmark funds. This is the money that we get, which is ring-fenced specifically for those categories that are mentioned here. The bursaries for international students, we had a budget of 21 million. As at the end of the financial year, we spent 19.8 million, which is 90%, almost 91%. The under expenditure was that 2 million. This particular bursaries, this particular earmark fund is for the international students. We've got students in Portugal, students in Russia, a student in China, student in Cuba, and then they have been paid from this particular bursary check. But we've seen over the years, the past 2 years, we've seen a decline in the number of students there. We are just continuing paying the fees for the students who've been there. There hasn't been any new intake of international students for the past 2-3 years, Chair. So we're just making sure that those that are there are completing, but those that are also completing studies and they are coming to South Africa, because of the integration program, we are also assisting them in terms of undergoing the accreditation of the HPCSA. They do write exams in Durban, so we're also using that money so that we make it a point that they are integrated back into the system. COVID-19, Chair, we had 324 million, Chair, was an adjusted budget because the COVID-19 grant, the allocation was 262 million. Through our engagement with provincial treasuries, we managed to get money through the first and the second adjustment. You can see that that budget went to 324. Originally, the budget was 262. Share. That 262 was not going to be sufficient to cover this 350 expenditure. The treasury assisted us. However, as at the end of the financial year, we still had a savings of 9 million because some of these COVID-19 employees, some of them were appointed permanently. And that's why you see that there's a bit of a savings there on the COVID-19. We're still having the same cohort of COVID-19 share that are on contract until end of December. We are engaging and identifying savings so that we can ensure that at least this cohort remain with us until end of March. So we are trying to identify some savings so that when the contract comes to an end of December, we can still then extend it for another 3 months up until the end of March. We've had some number of engagement with provincial treasury where we are requested that this particular COVID-19, because we are in need of this cohort. I'm talking about nurses, professional nurses, medical specialists that have been appointed through this particular program. It was not only for COVID-19. When COVID-19 after that particular period of COVID-19, we still had to retain those professional nurses because of the high vacancies at most of our facilities, especially in rural. So we are in need to retain those COVID-19. In actual fact, and make it a point that as and when there are opportunities for positions that are advertised internally, that we have for them an opportunity so that they can be appointed permanently. So we're engaging with provincial treasury to ensure that this budget really doesn't it has to become part of the voted so that on an annual basis, there can be an advantage of the baseline adjustment. But the intention is to have it permanently, not earmarked. So we're engaging with provincial treasury. I think engagement is positive so that this can then become part of the voted fund baseline. Cuban grant, it has almost spent 100%, and the infrastructure enhancement, Chair, we did not spend the whole money there, Chair. We spent 73%. Of the 10 million, 10.2 million, Chair, that was not spent on the infrastructure. 6.8 million. 6.8 million.
Chair. Chairperson.
I'm trying to check who are those people who are talking now. Is it not the MEC's office?
Apologies, Chair. My gadget had disconnected, so when we connected, I was.
Yeah. Thank you, Chair.
Let them read.
Chair, can you hear me?
Yes, loud and clear.
Okay, Chair, let me just continue on that slide. I was on the earmark. Wait a second. Can you still see the presentation, Chair?
Yeah, we can see it. Yeah, it's very clear.
Thank you. Thank you very much, Chair. No, Chair, I was just explaining that on the infrastructure enhancement, that 10.2 million that was not spent end of the financial year, 6.8 million thereof, we have actually applied for a rollover from Provincial Treasury because that 6.8 million is the balance of the money that the Department of COGTA had actually given to us for the disaster management center that we are actually building for them there at the hospital. So we're going to get that money back, 6.8 million, because end of the financial year, we had already issued a commitment letter, that 6.8 million, so that because one of the requirements, if we have to apply for a rollover, you must actually ensure that the money was committed end of the financial year. Yeah, I'm not going to repeat what I've just presented in terms of the narratives on the earmark share. There you can, there is 6.9 million that I'm actually referring to in terms of the rollover that we've requested from Provincial Treasury share. COVID-19, I've already spoken about it. That is the money that we got from Provincial Treasury, that 32 million, the second adjustment. There was also money that we also got in the first adjustment as well. Chair, the next slide is the accruals and payables, Chair. You'll see there that our total accruals and payables end of the financial year was 1.4 billion, 1.469 billion share. That is for the up until end of March 2024. The next slide will actually show the end of March 2025. The reason why we've shown this one for March, we just want to show the movement in terms of the reduction in terms of accruals, if you are to look for 2023, 2024, and 2024, 2025. So there you can see that the bigger part of it is the accruals is 263 million, and then the payables not recognized is 1.2 billion. So the two together then gives you 1.469. That's for 23, 24. Yeah. For 24, 25, there is a reduction from that 1.4 billion share, 1.327. So that's why we have shown. And I think this financial year, we're also working very hard to make sure that we actually reduce the accrual. This is the accrual that is actually creating too much pressure on our cash, as I had indicated, that we don't want the situation where cost to budget each and every financial year. So that is the accruals and payable at the end of March. On the revenue share, we've done so well, Chair. If you look into the target there, we have targeted to collect 187 million for the financial year 24-2025, Chair. End of the financial year, we have collected 308 million, Chair, which means we collected 64% more than what we had budgeted for next year. And Chair, this the whole 308 million is is a contribution from the Department of Health back to Provincial Treasury, because that's revenue surrendered back to Treasury, and then it's actually given to all the departments within the province. So the department's contribution was immense. If you look into the bigger portion of the 308 million, in the 274 million underpaid fees, we've collected in excess of 200 million from the government of Lesotho, only for that financial year. 1st of April 2024 until 31st of March 2025, 274 million. Of it, more than 200 million comes from the government of Lesotho. We had debt owed to us by the government of Lesotho for a number of years, and in the previous financial year, they in actual fact had paid us a lot. We're still having a portion that is still remaining in excess of 80 million, and we're planning to have an engagement with the government of Lesotho before the end of the second quarter. But obviously we have to congratulate them for the effort that they put in giving us more than 200 million in one financial year, and we will be having a meeting with them so that at least they can maintain the current account, so that you don't have a situations where you've got some arrears. That is the end of the presentation there. Thank you very much.
Thank you, CFO. Let's have members interacting with the presentation.
Two questions. Accruals to the tune of 1 billion. Can the CFO take the committee into confidence? What is happening there? Why to that extent? Why is the department not able to resolve that matter? I don't know if it's related to the issue of the contractors who did work with the department, and for the longest they could not be paid. Where are we in terms of that issue? 3, Chair, Department of Health is known historically to have a high litigation bills. Where are we with regard to that matter? And lastly, the CFO said monies were returned to Treasury. How much and why was money being returned? Why was it not spent? Thank you.
Thank you. Any other hand?
Thank you, Chair. Chair, yes, just in terms of the earmarked funds under the infrastructure enhancement allocation, that underspending, I do note that there has been a request for a rollover, but can we just get an indication in terms of why wasn't that full 10.2 million spent? Is it an issue there with contractors or supply chain management? And unfortunately, I couldn't hear where the department is assisting with the disaster management center. I think it's at Pelanomi. If the department can just confirm that again, where is that upgrade or maintenance being done? Chair, then earlier in July, when it came to a briefing that we received on the Division of Revenue Bill by National Treasury regarding the Free State's division, I did note, and I posed a question to National Treasury regarding the allocation that was received by the provincial government in Limpopo, as well as in the Western Cape, regarding, apologies, let me just get to that slide, regarding changes to provisional allocations, and there the Limpopo province as well as the Western Cape province received a budget facility for infrastructure for for health sectors specifically. So it's called the BFI for the health sector. And my question to National Treasury was, but did the Free State also apply, the Free State Provincial Government also apply, perhaps for additional funding within this BFI for the health sector? And they indicated yes. And then I wanted to know, well, if there was an application, why didn't the Free State receive, further allocations? So my question to the department is that, did we apply, did we present a business plan to request additional funding in terms of this BFI in the health sector, specifically noting the issues that we have in terms of our infrastructure across our various hospitals and clinics in the province? Because there's a 1.1 billion allocation that's been made to the Siloam District Hospital in Limpopo, and then 2.3 billion for health technology at the Tygerberg Hospital in the Western Cape. So if we could just get an indication, and if a submission was made to National Treasury, a business plan was submitted, did the department receive any feedback as to why we weren't successful? Is there perhaps an issue with the business plan that was presented? Because in future we definitely have to apply for more funding to get our infrastructure, our hospitals running, because I think the pressure is immense currently, especially noting many of our facilities being closed now and then by Department of Labour, etc. Thank you, Chair.
Thank you. Any other hand? Over to you, HOD.
Chair, I see Honorable Foko's hand is up. I don't know if it's...
Honorable Foko. It doesn't. I don't know why I can't see that hand every time. Honorable Foko.
Chair, no, Chair. But thank you very much, the Chair and the Department for the presentation, Chair. Chair, my question is about the COVID-19 structures. The one in Bongano Hospital. Is it the department planning to do something after the budget, Chair, and also the Pilinomi, the buildings in Pilinomi, they need a serious attention, Chair. Is it the department doing something about that? Thank you very much, Chair.
Thank you. Over to you, HOD.
We'll start, and then I will deal with some of the questions after. Thank you.
No, thank you, Honorable Chair and honorable members. In response to Honorable Meku's question, Chair, yes, our accruals at the end of the financial year, accruals and payable is correct. It was 1.3 billion. The bigger fraction of that one, Chair, is the health facilities management grant. Honorable Meku was correct in terms of the infrastructure that we had. Infrastructure, we had an accruals of 400 million, Chair. In fact, it's a bit of a pressure, Chair, because the budget for the infrastructure for this current year was actually reduced by 100 million from 700 to 600 million. So if you're still carrying the accruals of 400 million, it actually put a lot of pressure, and that's why the decision was taken that for this financial year, we need to deal with this accrual. So there will only be a few projects that will be implemented, projects at National Hospital and project at Pelonami Hospital, because those are key, so that we can reduce the accrual, Chair. But I must indicate that a lot of work has been done in terms of verification of this 400 million accrual, so that we know for a fact that there is value of what we pay. But we know for a fact that it is also not acceptable, really, for the department to have such a huge accruals year on year. But there has been a slight decrease compared to the previous financial year. And another issue, Chair, like as I've mentioned, is that I think I've indicated that towards the end of the fourth quarter, talking about January up until March. The situations where in most of the time we do have the budget, but the cash that is available us at Provincial Treasury is not sufficient. So then that is the period where then we'll have to make it a point that at least we pay the salaries. And I think that's what led to the 281 million that we had reported as unspent and surrendered to Provincial Treasury. But I've also indicated that we've engaged with Provincial Treasury where we are requesting 156 million of the 281 million back from Provincial Treasury, specifically because we've already had in expenditures, which is part of this accruals which we have to pay. So we'll hear from Provincial Treasury. So it's not like the whole 281 million is gone to Treasury. We are very much sure that we're going to get at least 146 million of that particular one. But yes, we'll continuously have a problem like this one. We've developed a strategy in terms of dealing with the accruals. We've committed that each and every financial year we have to reduce at least the accrual by 15% so that we find a situation where budget is equals to cash from the beginning of the financial year. But I've not get a comment from Honorable Mego. But yes, infrastructure is almost 400 million of the 1 billion accruals. Invoices have been verified and they have been paid in this new financial year. Yes, I think Honorable Member was correct. There is a project at Pilonomi Hospital. It's actually for the refurbishment of the EMS, which is the ambulances. And then in the same property, we've agreed with COGTA that they are going to use that particular facility. There's an area that has been earmarked for the disaster management. So there's going to be a call center there for the disaster management. We have received money from COGTA for that particular purpose. And as I indicated in my presentation, the 6.8 million is the rollover that we're going to get. Unfortunately, end of the financial year, we're still having those invoices that were outstanding for that particular financial year, Chair. And it is on that basis that we managed, because we had created an open order of 6.8 million, so that we can then start paying those specific invoices in this financial year, so that at least we can have an expenditure on that one. So the 6.8 million, that one is not for the EMS, it's mainly for the disaster management center, which is the money that we got from COGTA. And yes, indeed, the center is going to be at Pilonomi Hospital. I think I'll request HOD perhaps to comment on I think we'll talk about the issue of the Division of Revenue Allocation, BFI. And I think we'll also talk about there's quite a number of projects that the department is implementing at Pilonomi Hospital. So I think HOD will also touch base on that. We are ensuring that all contractors are back on site working, so that one of the projects there is the maternity ward. That's been running for many years. So we are anticipating to ensure that that maternity ward is addressed, so that it can address the backlogs in terms of patients that we normally see at Pilonomi in more patients here. But there's quite a number of projects that are currently running at Pilonomi. HOD.
Thank you, Chair and honorable members. With regards to the issue of the budget facility for infrastructure, the province of the Free State has been together with municipalities, because this facility for infrastructure is open to all the departments at the provincial level, national level, as well as municipalities. So over the last few years, the province has not been successful in its applications to National Treasury for this funding stream. As a result of that, whilst I was at the Provincial Treasury, we had a workshop with National Treasury. I think it was held about 2 months ago, where we requested this unit that dealt with this funding to come and engage with the province together with main municipalities in the province. And what became clear from those engagements was that our applications as the state were not considered, because they were not addressing all the issues that were required, either in terms of planning or in terms of information, in terms of the bankability of various projects. And in some instances, some of the projects were below R1 billion because this funding is only for projects that are more than R1 billion. However, there are instances where projects that are less than R1 billion can be considered. Now, with regards to the Department of Health in particular, there is a project or two projects that the department has applied for. One of those projects is the grade of the psychiatric complex, and the other one is the new district hospital in Mangaung. What the department did was to apply for this funding through ISA, Infrastructure South Africa. Now, Infrastructure South Africa and BFI are two different funding instruments, but they work together. So the application was not successful with ISA. ISA made a recommendation that the department submits this application to the BFI, which is the Budget Facility for Infrastructure. So that application is ready for submission to BFI. However, one of the conditions is that National Department of Health must support the application. So this week, or exactly yesterday, I signed a letter that is addressed to National Department of Health, where we are requesting them to support the two projects that will be submitted to the BFI. So once that process is completed, when funding is available, it will then be gazetted. So it means for the two provinces, they had gone through that process and the process was successful. So for us, we are still at the point where we now must resubmit to BFI because our previous submission was to ISA. On the second issue, Chair, the one of Pilinomi Hospital, we have decided as the department and guided by the MEC that we must focus our resources, especially in the district of Mangaung, on Pilinomi as well as National Hospital, because we have a number of projects that were started over the years. Some are still in construction, some only planning was done and nothing has happened subsequently. So we are now focusing on these two facilities to ensure that all the projects that are currently being implemented are funded appropriately. All the service providers are brought back to site, including consultants, because in some instances, some of the consultants were terminated before they could complete. The contractors were not being paid. So we have already paid some of these contractors, and we are now working on a strategy to get them back. So we are also going to work with the management of the hospital to ensure that when they are back, we don't have a process where they will start working and then they will be stopped because of operational issues. So we are going to ensure that in that plan, we take along the hospital management for them to assist us in terms of making sure that once we start, we're able to complete. So at a later stage, we will present a plan, a project with timelines in terms of the projects that are currently underway. But that is where.
Thank you. Are there any follow-up questions?
Yeah, Meko.
Pandemico.
So let's request the HOD through the MEC to indulge the committee with that plan. But next time when we meet them, we request you, Chair, that we provide just small presentation on that plan. I'll tell you why that plan becomes important. Department of Health, I think, is the second biggest in terms of its budget after education. and provides very key services to our people. In other words, Chair, the majority of the perception about government failing or government succeeding to service our people are generated from this department, especially through the district services. And that's why, I've consistently been raising issues, MEC Mahlati, about the money around the infrastructure development of the Department of Health, given the state of our hospitals, Linomi being an example. Money retaining, contractors not being paid. And I think the HOD is giving us hope or no. His arrival has got the necessary energy to ensure that that plan is crafted and implemented. And that's why I'm saying the committee must be indulged. Because you see, Chair, if you address the problem of the accruals by limiting infrastructure projects, it means the department is having challenges of the implementation capacity. And I would hope, HOD Mhlahlo, that your plan talks to that. We don't want accruals being managed in a manner that creates yet another problem of the much needed services to our people. So it was just that request, Chair. My apology, it took long to substantiate, but I think it will be key that the department succeed with regard to that plan, including implementation, and please let them take PROPEC on board in terms of how that is going to be done, so that we are assured the budget of the department must remain or there must be increases. We don't want decreases, because this is a very critical department in terms of the health services to our people. The majority of the issues which are coming out of the MEC knows. I've been engaging him, Chair. What do you call this thing? Our people have been unable to bury their loved ones. I referred a number of cases to the MEC, Chair.
Autopsy services.
Yeah, more
Postmortem services. Postmortem services. Postmortem services.
Yes, there's been a serious problem there. And that's why I speak without contradiction. The majority of the perception of the entire government is generated from the Department of we're even called by people outside the Free State because their loved ones have passed in our province. And this is a very emotive issue. It's a very serious issue. It borders on the integrity and the dignity of our people. You know how our people take these issues to heart about the respect of burying their loved ones. And if it's not been done, a family takes about 2 to 3 weeks. It just got cost implications in the process. So I'm thinking, Chair, that plan of the HOD, I know the HOD is arriving, and we have hope that, his touch also around the finances will help the department to be able to manage the issues of their finances, because it has been a problem over time. Let me rest there, Chair. Thank you very much.
Foko, is your hand up or is that old hand?
No, it's not old hand, Chair. It's the new hand, Chair. Chair, is the follow-up question, Chair. I didn't hear the HOD answer that one of Bongani Hospital, Chair. Why I was asking that, Chair, I understand that the HOD was talking about the plan that they are focusing now in Mangaung, Bloemfontein. Now, I just want to check, Chair, should we wait for something to happen outside the Bloemfontein, and it's when we are going to react on that? but I'm covered also by Honorable Meko now, because now we are still having a problem at Thabo Mofutshanyane. The mortuary there is not yet up and running to date, Chair, because the other department decided to close the mortuary there. And I think that mortuary belongs to the health department. We're supposed to do something as department to make sure that we talk to that department and we come up with a plan, Chair. Let us department come up with a plan, because now when we're supposed to take our beloved ones there, we take them to the hospital that is next to that mortuary, and it's taking a long. There is a queue there because some of the facilities they are small and they can't carry more than 10 people, and our people are dying, and they need a space, Chair. And when they appoint people, they must not also appoint people that they are going to do the same mistake that they did in Thabo Mofutshanyane. Because remember that they appoint someone to come and feed where what do you call this thing? But visa in the lights, they are not meeting the standard, Chair. Is the report that we receive from the department that they don't meet the requirements, because the requirement says it must be 15 meters long and maybe a 5 width. So now, Chair, let us make sure that when we come up with that plan, we fast track that one of the mortuary at Thabo Mofutshanyane. Thank you, Chair.
So, thank you. Over to you, HOD.
Chair.
Thank you, Chair. I know that the MEC will respond to the two issues in particular, because there are things that we deal with on weekly basis, and we do engage with the MEC where we provide feedback. So I will not go into the details, but we do have a plan on the mortuaries that is currently being implemented to ensure that all those mortuaries that were closed are back in operation. But the MEC will be able to respond. Thank you, Chair.
If you allow, Honorable Chair.
Please do.
Thanks, Chair. Chair, I think the issues that have been raised are greatly welcome. And thank you very much for raising these issues to a certain extent. Coming to the committee for us, it's also like looking into the rear view mirror and also understanding the environment that we are in. And I would really like to appreciate all the issues that have been raised, and we welcome all of them and take them in a positive light. The issue of the mortuary services, I think the HOD has captured it well. And let me indicate, Honorable Chair, that there's people out there who have hope in this government. There's people out there who still feel that they need to support what government is doing. And I'm raising this point because we even have people who are willing to come on board and say, Department of Health, we know that you are under pressure. Don't deal with this. We'll deal with it ourselves. Like the issue of the mortuary. There's a business, there's an organization that has come on board to say they will assist us to revamp and deal with the issues at Thabo Mortuary. And that process is going to be concluded very soon. But as we speak now, Chair, Honorable Meko is correct. And we have stopped dealing with those calls now, because starting from last week up until this week, we no longer have backlogs in our forensic mortuary. On Monday, we had 9 bodies requiring autopsies. and 8 of them were done on Monday. As we speak now, we don't have backlogs. Our turnaround time of 7 days remains intact, and we believe that will sustain that going into the future. So that's something that's quite positive, and we really appreciate the support and understanding from the members of the legislature generally, because calls were coming from right across the organizations, from members of the legislature. Honorable Chair, the issues of Bongani Hospital and infrastructural issues, there are consultants that were appointed there who have done their work, they've done their assessment, and the report is with us as the department, and we are costing that and to include that in our plans to ensure that there's work that's been done in relation to that part. And one of the key issues that has been raised there is infrastructural issues that Honorable Foko is referring to. So the issues of Bongani are not set aside. The issues of Bitumelo Hospital are not set aside. We were just saying, let's deal with these other issues so that we can also concurrently deal with others. Chair, we have to find a way to break this vicious cycle of accruals in relation to infrastructure, and that's what we are implementing as it stands. Yes, the issue of accruals, there's no easy way to deal with it, Chair. We would have to, delay other projects in order to break this cycle and make sure that moving forward, we're moving on a clean slate. So it's not going to be an easy thing. But two last things. I think the plan, once we have concluded it and have shared it with all the relevant people, offices, then we'll come and present it to the committee so that the committee is fully aware of what is it that's happening. I don't think we'll wait for the next invite. We can share it even before we are invited. And the last thing, Honorable Chair, which I know is on the hearts of the members of the committee and ourselves as well, is the issue of dealing with the long queues in our facilities, particularly in the clinics. And that matter is receiving attention from us during the current month, and we are hopeful that we'll see something changing. And yes, Honorable Meko, we, as the MEC of the department, I'm really encouraged by what has been happening in the department in the past few weeks, and I'm hopeful that we are going to turn the corner very soon, and our projects are going to be fully implemented, and we are going to make progress in that regard. So, Honorable Chair, let me stop there, trying to save your time. Thank you very much.
Thank you. I think that was concluding the presentation of the department. I don't know whether the MEC wanted to. I don't know whether MEC wanted to make the closing remarks, but what I wanted to. Is there anyone who wanted to make it to follow up?
Yes, Chair, if you may, I think HOD would like to say something.
No, thank you, Chair. I just wanted to check, Chair, if we should deal with the medical depot.
Oh, yes, medical depot, yes. Okay. Yes, before the medical depot, my issue was that on this, the problems that these kids that come from Cuba by experiencing, and maybe any other country where they are studying medicine, especially Cuba, because that's where you have a bulk of them. Have you ever interacted with those medical schools on the issue of the curriculum to alert them on issues that the students experience once they come back, so that as they develop the curriculum, they also cover areas that are pertinent to our own situation, which these kids will become confronted with once they come back. so that they don't struggle with their board exams. And secondly, I think the second issue that I have relates mostly to Treasury and not yourself in relation to surrendered revenue, because it goes to the question of how the budget is structured in relation to the fiscal policy. I think that one it's more towards the Department of Treasury. I think that comment will just it's just a rhetoric comment that would need the department maybe to look at it as you go back to make reflections. The presentation of the medical depot, I hope it's not going to be as long as the one of the department. At most, it must take 15 minutes. Over to you, HOD. Don't listen to the MEC. Over to you, HOD.
I'm keeping quiet, Chair.
Yo, I know your silence is very loud.
Thank you so much, Chairperson. The first two slides are standard. The third slide talks to the budget versus expenditure for the last quarter, whereby during the current the 2024 financial year, we had that we focused more on reducing the debt, and as a result, the sales were also reduced and sales to the department were also reduced, and therefore the purchases from the suppliers were also reduced. As a result, the income reduced by 14%, and then the salaries and wages were also underspending by about 14% due to the or 12% in overall. This was mainly due to the vacant funded posts, which are currently being filled. In terms of expenditure, in overall, we were underspending by 15%. This 15% under expenditure was mainly due to the underspending due to the point that's mentioned about the medicine, whereby we focus more on clearing the debt and reducing the accrual instead of buying more and more medicine that was not actually necessary. So we managed our stock levels. We made sure that medicine is distributed between the facilities, and this also helped us a lot in terms of reducing wastage and expiry of medicines. As a result, we underspent slightly by 15%. And in overall, at the end of the financial year, we were expecting to make a profit of 9.4 million. And in the end, we ended up making a profit of 13.5 million. This is a great indication, which shows that the medical depot as an entity is continuing to pay for to cover its own costs and to rely lesser and lesser on the department for bailout or even treasury, which has not happened in the last many years. The next slide is around the narratives, which we've already talked to, and then the bank and creditors as at the end of the third quarter. Depot had 46 million in the bank account, and there was 337 million in terms of the suppliers who had to be paid. Both these amounts have reduced greatly because we currently keep about 5 million in the bank account for the operational costs, and then currently we owe the supplier about 167 million. The bank and creditors, we have already talked to it. The next slide is about the revenue collection. This is the debt that the department owed the depot as at the end of the fourth quarter. It was 583 million. It has also drastically reduced to date because of the payments that came after year end. Irregular expenditure, we have not compared any irregular expenditure, at least in the last 3 years. The last slide is around medicine availability. In terms of medicine availability, we measure it in two indicators. The first one is the tracer drug availability. The planned target is 78%, and the fourth quarter target is 80%, and we achieved 81% of the target. The last target that we use is for service level for the normal orders that the facilities played from the medical depot. We were on the targets is 80% for the plan for the year, and the fourth quarter target was also 80%, and we were on 96% of the medicine that is on the medicine for normal orders that we submit to our facilities. Thank you so much, Chairperson.
Thank you. Thank you. Thank you. Any questions, honorable members? It looks like the presentation is loud and clear to everyone. I don't know whether MEC would want to make the closing remarks.
Honorable Chair, thank you very much.
Yeah, this is the time. This is the time where that loud silence of yours is needed.
Honorable Chair, honorable members, thank you very much for the opportunity, and we also welcome the issue that you have raised on the issue of the Cuban doctors, and we'll take that back and look into it against the backdrop of the presentation that was done by both the CFO and the HOD, that we do not intend increasing the numbers, because as it stands, we already have enough supply of qualified doctors coming from local universities. So we do not think it is wise to increase the numbers on the other side, but we'll reach out and look into what is it that can be done so that we can have a seamless integration of the students when they come back to the country. Chair, thank you very much. Thanks to the legislature team, honorable members that are here, and to the health team. We really value the time that we come here and present to yourselves, and always appreciate your wise counsel. Thank you, Honorable Chair.
Thank you, MEC, HOD, and the team. Thanks for honoring the invitation. If you can leave us in peace, so that the members of the committee can be left alone. Thank you, MEC. Please leave us.
Thank you. Thank you.
Honorable Skobela, gadget ya isebediswa ke mang?
Who gave you the permission to speak? Honorable members, that's the presentation from the department and the medical depot. Dadefoko. Your comment. Any comment from the presentations that we have just received? Or it looks like members don't have anything to say with the Department of Health, except the comments that the members have already given during the questioning session. I think that concludes the business of the day, honorable members. Unless there's any other issue that stops us from adjourning the meeting.
Chairperson, the draft reports that needs to be considered, the second and third.
The draft report, do you have them now?
And Dr. Morometsi is going to present the Chair.
Oh, we are also going to have that.
Yes, Chair.
Okay. Brother Steve.
Chair, good morning and honorable members. Chairperson, the reports were actually posted on the website of the members. I just hope that members had an occasion or an opportunity just to peruse through it. I don't know what Chair wants. Do you want me to present in totality, or I have prepared actually just analysis on both reports on their performances of the departments, and not to go slide by slide onto the reports respectively. I don't know.
No, can you
what you think?
just start with the second report, the second quarter. Members can just tell us what issues do they have with the second quarter report, and then we go to the third quarter. Just put up the second quarter.
Could we ask the IT personnel to assist us to put it on? Chair, I'm not going to go page by page with it. I've just made a summary around all those two reports.
No, just go to the recommendations, the page of the recommendations on the report.
Okay.
Then from there, you can then check. You can then go to the third quarter.
It's dark, Chairperson. I can't see. Yes. There's the second.
Why is it dark?
No, I don't know. I can see it now. Maybe let
yeah,
Steve
I can see it, but the background is dark. Why is the background dark?
Maybe he needs just to lighten it up. I don't know what. Just put it up again, Steve. In the Mahange is assisting us, Chairperson. Chair, while we're waiting on that, maybe let me continue and just make my comments. With regard to the second quarterly expenditure report, Chairperson, I think the departments in general did not perform well. There were few departments that performed acceptably with regard to the percentage of at reaching at 50% or so on. But generally, the departments were poor. And there were few departments that were able to reach the 50%, like Department of Education at about 63.5%. And then Department of Health, with regard to the collection, they had about 113.4%. Yes.
You are going to prolong the presentation. Just go straight to the recommendations.
Okay, let's do that. What we are seeing here, let's go. It's still, actually. Yes.
Stephen, the layout should not be in a book form. It's a layout one.
Maybe page by page would be sufficient.
Yeah.
Just put it up page by page. Yes, that's it, Chairperson.
Let's
go straight
let's
to
just
the
go from
recommendation.
yeah. Let's see the recommendations under each. Let's go to the recommendations. I think under each column, Office of the Premier, yes, just it's a beginning of a yes. So there were findings with regard to the Office of the Premier, and the committee was concerned about the Office of the Premier for delaying the concurrence of critical senior appointment of critical senior positions of most of the officials across the department, and it is failed when departments had to return funds to Provincial Revenue Fund due to non-spending of allocations and disrupting the overall performance of the department. And anyway, Chairperson, this go to the Department of Provincial Treasury and many other departments, but I know the Premier commented on this issue, and I think that they are in the process of protecting it. You can go on. Go on, Steve. Yes, just hold in there. With regard to the following department, members had also concerns there of the committee resolved to continuously raise the issue with the sluggish performance of the department on the conditional grants, particularly on infrastructure and the condition of provincial roads in general, and the forfeiture of funds to National Revenue Fund. But it was also made, a mention was also made in the fourth quarter that the whole question of infrastructure is still an issue, and it would be unfair and it would be unacceptable for funds to be returned to the National Revenue Fund. So departments need to put their business plans in place and adhere to all the regulations and the adherence of legal instruments. Let's go on. Right, Steve? Move it. Let's go. Right. Right. Chair, this is the Free State Development Corporation. But the issue that is there, it's the issue between FDC and MAP SEZ. And I think the matter or the recommendation would be that the MEC and the concerned parties need to be convened under one roof, so that they are able to iron out the issues that FDC does not release the MAP SEZ to be independent and start to accumulate funds and so on and so on. So the committee felt that that issue needs to have all the department and provincial treasury as well involved there, so that the matter, when it comes to the legality of the issue, needs to be addressed effectively. Let's move on, Steve. Right. These were just the reports. You can go on. Right, go on. Right, let's go back to the medical depot. I just want to spend some time there. Chairperson, the problem there was the committee felt when the transfer is made, the transfer needs to be made timelessly, so that the depot must be able to attend to issues that are affecting it with regard to the accruals and the payables and so on. So we're hoping that, because this matter was also raised during now when the Department of Health came, that they need to improve on that transfer, especially maybe within the first quarter. Then a total of that must be transferred, not in portions, so that the depot is able to perform its functions effectively. Let's continue, Steve. Right, let's go. Let me see. Okay, go on. Just a word of with regard to the Department of Agriculture, Chairperson. The issues that they encountered during the second quarter. You will see when we do the third quarter that most of those issues would have been resolved with regard to the department becoming functional again, and even seeing their performance increasing, and they are able to adhere to all the things that we tabled them. Let's continue again, Steve. I think that's probably. Yes, that's probably the last presentation. Chairperson, this is the general recommendation of the portfolio committee. So I'm just saying now that we've come to the end of the second quarter, if there are any issues that members want to be included in the report, and I understand these reports have been from the 2024-25 and coming a long way, but I'm saying if there are any issues that members before the report is tabled want to include in the report, I would appreciate it. They can just slot them in at where the group is. Chairperson, yes.
I'm the chairperson. Yes.
Oh, chair.
I said give the recommendations. Yes, the rest will be done by me.
Okay, no, sure, Chair.
That's the second quarter. Any comment from members? No comment. Let's go to the third quarter.
Yes, Stibaro, no, thank you, Chairperson. I will not be too disruptive anytime soon. Are you winning, Stibaro? Through you, Chairperson? Echo Romanizzione or Magic can assist there as well. But I want to get that quarter. Sorry for the delay, Chairperson. I think he's just searching. Yes, thank you, Chairperson. We're still gonna go the same way that you said that we did.
Yes. Recommendations, yeah.
Yes. So maybe can start, but go. It's fine. Let's just a little bit. Yes. Yes. Okay. Just begin actually tap. Yes, Chairperson, through you, Chair, you will notice that could the entities, could the entities more. Yeah, just hold it there. You'll notice, Chair, this issue, yeah, you'll notice, Chair, in the report, some of the issues are related to municipalities, and especially when it comes to the department, either at Treasury or the Department of Governance. And then we will reflect them in the report so that both the MEC for COGTA and the MEC for Provincial Treasury would be able to respond towards the issues. Let's continue again. Right, just hold in there. There was an issue with regard to the Free State Development Corporation in terms of performing its mandatory functions, and I think maybe when we come to the fourth quarter, Chairperson, we would probably be able to see some changes with regard to the issues that regards MAP SEZ as well under as a subsidiary of FDC. And the issue here is for both Provincial Treasury, Economic Development, and the office and the stakeholders involved, just to be convened under one roof, so that the issues that are actually challenging them should be resolved amicably. Right, let's go on, Steve. Right, before Oyako Kudimo. Yes, just hold it there. With regard to FDC, members were concerned about the governance matter relating to the entity becoming independent from FDC and self-sustainable on its own. I don't know, Chair. I haven't had an occasion just to go to the regulation that administers both any entity that is actually within the broader scope of the legality. But this issue has been coming for a long time, where MAP SEZ were actually saying that they would really like to go their separate ways and not be a subsidiary. And subsequent to that, when MAP SEZ came and presented their fourth quarter, there was an issue with regard to when they presented their presentation, Chairperson. There were astronomical kind of funds that they informed the committee that they are going to refurbish or conduct infrastructure around the fence and so on and so on. So after that, members of the committee just felt that I think the next visit or site visit could be to MAP SEZ to go and see with the funds that they have, the astronomical funds that they set, in terms of doing those things and the appointment of those consultants and so on, just to go and see and get the presentation from MAP SEZ and see how pliable that is possible. Yes, Chair. Right, Steve, you can go on. Right. Okay. Let's go on. Health one more. Right. Let's go. You can go. Right. Just hold it there. These were actually, I've included all this information here, Chairperson, during the time when the department came and those questions that were posed to them, and then they responded. You'll see that the issue of the accruals and payables are also and of course they said it's a historical matter, this one, and I hope that going forward, what they have said in this presentation, when they appeared now, what strategies are they going to put in place to be able to rescue the impasse. Let's go on, Steve. Right, I'm not going to through you, Chairperson, I'm not going to comment on the medical depot. I think the department has make an undertaking that they would adhere to the timelines with regard to the transfer of the 40 million to the depot. Thank you. Let's go on, Steve. Let's just go slower, more education. Let's go. Yes, let's go a little bit. Yes, come on. Actually, let's begin. Take it up. Go on, go on. The findings and concerns. Right. At that time, Chairperson, it was an issue with regard to the learners with profound intellectual disability grant, and the committee requested that the department must provide the committee within 7 working days in writing, and so on. And the department responded also on the issues that are reflected. And one of the issues was the Disaster Management Center at Pelanomi, and of course the department just touched on it, and there's a way forward with regard to that. Let's go on, Steve. Let's go on. Right. Let's go just beneath the right. The Department of Sports, Arts and Culture. Actually, it's a beginning of out that the department provide. Okay. Now, sorry. Go on. You can proceed. Right. Let's go on. Right. Just hold it there. It is a happy begin again. Because what the department. Yeah. Just here. Okay. Right. Some of the issues, Chairperson, you'll notice they originated from at the time when the department came to make its presentation with regard to the appropriation bill. And one of the issues that the committee also raised was the old 2-roomed houses that members of the communities are still issued with. And the Department of Human Settlement responded, and I hope they would also be able to when they do come again next time, Chairperson, they would be able to give the committee a comprehensive response with regard to what they have done. And of course, you would also include maybe in this presentation or in these concerns that, Chairperson, I think there would be a time that maybe the committee would be able to make time so that they must be able to go on site visit and go and see what Human Settlement have done so far, and because there are funds that are actually allocated in that regard. Right, let's go on, Steve. Right, let's keep it there. Just hold it there. There were also findings here, Chairperson, as to why the accreditation of the water laboratory issues are not attended to, and obviously, Chairperson, some of the issues that are here are issues that the AG also touched on, and I guess when as time goes on, they would be able to respond satisfactorily to matters that they issue. And of course they were also requested just keep it there, that the department must also provide a comprehensive report. And I think probably some of these things that the committee requested the department to do, they will probably come back when the report is tabled in the House, and then all those issues that the committee has raised would be converted into resolutions, and they would come back to the committee again, and so that the committee must be able to see whether the department responded in totality, and if there are adverse responses, the it might be set back and said, right, let's go back and can you submit again X, Y, Z and so on. But I think these are resolutions that are going to the House, and surely they would come back as to the committee as well. Let's go to agriculture, Stibo. Let's go. Yes, let's go. Just keep it there. Keep it there. Keep it there. Chairperson, when it comes to the Department of Agriculture, we know the issues that members raised. Actually, the beginning of fella, I just want to read the recommendation where the committee said yes. Actually, the happy beginning, Stivo. Yes, just there. The committee recommended that the department must ensure that all financial or resources transfers are closely monitored to confirm that they are utilized for the purpose intended for. And also something that has to do with the CPAs that are non-compliant with the legal prescripts and or frameworks governing them. Funding must be withheld until they are fully compliant with applicable laws and regulations. That all common agents must operate through a designated combination account held by individuals to ensure proper governance and accountability. And now, Chairperson, so these were some of the issues that members were very passionate about it, and I think we will see when we go to the fourth quarter expenditure. But thank you very much, Chairperson Tokubane. And then the recommendation of the committee is that the Provincial Revenue and Expenditure Performance Report for Provincial Department and entities for the 2024-25 financial year be adopted by the House, and that the department respond on the resolutions within 30 days after the report had been tabled as a resolution of the House. Thank you very much, Chairperson. Thank you, Stivo. Over to you, Chairperson.
Thank you. Those are the reports, honorable members. What is your comment on the reports? If there's nothing out, now from my side,
Chair, my hand is up. Chair, my hand is up.
Okay, Dadufoko.
Nice to call me, Chair. Chair. Thank you very much, Chair. Chair, I just want to check something here. Last time, when the entity that is FDC and MEP CZ was presenting, there was a suggestion that because of they are doing the same thing, why can't we do a one entity? I don't know. I just want to confirm.
Where we were saying that the FDC and I wanted to understand that you say FDC and MEP SEZ should be one thing.
Yes, Chair. I just want to. I just want also to confirm, because there was something like that when we, after they present their budget, and we said no, it is not proper for them.
Because most of those facilities of FDC that they've been referred to were in the same place with MEP SEZ in Kwakwa, most of them, that we have to have, so that when we talk about, you remember they were talking about the lights that they were fixing, so that as we talk about these issues, that's what I remember.
Chair, my hand is up.
That
SEZ and the FTC. I think partly, Chair, you are correct in terms of our attitude towards these two. We will never say that they are the same, because they are not. What the committee needs to demand from the MEC is a plan to finalize what has been a governance challenge between FTC and Special Economic Zone. And our recommendation, Chair, must be there, so that in the process we are not tempted to overreach and instruct government what to do, that to match the two. They can't be matched by law. The problem, Chair, if you remember, Special Economic Zone essential is to attract investment both locally and international, focusing largely on manufacturing. And inside the parameters of the special economy, because it's established by law, and that land is regarded as a brown area. In other words, anything and everything that happens there or should happen there must be purely on the basis of investment. And government must go out, attract this investment, bring it to the special economic zone, so that it benefits the Free State economy. The challenge historically that the special economic zone, Chair, is established under by law. Although in terms of the operation, it should not be. So the Chair is correct. Part of the problem is that the property of there's some property of FTC that is inside the special economic zone. Who are inside the special economic zone must pay their rent to FTC, not the special economic zone. That's a major issue. Now, our recommendation must say MEC Portfolio Committee, in the interest of financial stability of the two institutions. I don't know if they ever achieve financial stability. But the problem is that FTC is affecting the operations of the special economic zone. Funding the special economic zones of the Free State, but others throughout the whole country are being funded. The issue should be, Chair, that MEC this matter, that trade and industry must also start to consider to fund the special economic zone.
That Honorable Meko's line is.
No, yes, complete. Professor Bua.
It's fading, yes. I don't know.
Can you raise Venom?
Are you back?
No, it's me, Chair.
Oh.
Chair, maybe I'm speaking English law here. Maybe there is no understanding. Let me put it in this way, Chair. I wanted to be reminded because there was something like that, and yes.
No.
So you reminded me. It's fine, Chair, with that. Thank you very much.
Thank you. Is there any other issue before I close these discussions?
Chairperson, the only issue is to tell you that I'm all right with your summary. Thank you.
Okay. Thanks. Honorable members, I think that concludes the consideration of the two reports. The second
Chair.
and the third. Oh, that Majiki.
Sorry to intercept. I'm just reminding Chair to adopt the reports formally. They must be voted for.
Yes,
Second.
yes, that's where I was going. Yes. Oh, thank you, Miss. I wanted to conclude these two reports, and I wanted any proposal for adoption of the two reports.
Chairperson.
Thank
you, Chair. I move for the adoption of the report. Thank you so much.
Any seconder? Dadefoko?
I then move, Chair.
You second?
Yes, Chair.
Thank you. The two reports have been adopted. Is there any other issue that is still outstanding, Majeki?
No, Chair, not at the moment. Thank you.
And can you direct me to adjourn the meeting, Majeki?
Chair, you are free to adjourn the meeting. Thank you very much.
Honorable members, I think that concludes the business of the day. Thanks for your patience and ensuring that we conclude the business of the fourth quarter reports and also adoption of the second and the third report, second quarter report and the third quarter report. Thank you once again. See you next time.
Thank you, Chair. Thank you, Honorable
Thank you,
members.
Chairperson. Thank you, honorable members. Thank you,
Chair.
Stibaro.
Thank you, Chair, for appointing Majeki as Deputy Chairperson. Thank you very much for that.
Chairperson, Chairperson,
Thank you, Chair.
Chairperson, next time you have the item here, how Lenda de Fuku, how to Savoni, Upper Mr. Lito.
Hey, yeah, man, I don't know what is happening. No, the problem isn't that the folk these cheap gadgets that are sold in the street.
Job Shada.